How well? So for VA disability compensation, we're telling the VA that this injury, illness, or exposure is continuing to affect the veteran today. So for example, we'll use a Vietnam veteran who was exposed to Agent Orange during their time in the country. Or maybe they were a Navy veteran who served within 12 nautical miles. And actually they opened up that to Guam, Cambodia, Laos, Thailand. There are a slew of new Agent Orange identified locations. And if you think that could be you or your loved one, please contact our office to investigate that matter. And that's, once again, and I'll say our contact information many times during this presentation, 512-943-1900, or you can also email us at veteranservices@woco.org. For those that are present, you will receive my business card today with that contact information. And we do have our information on the flyer that we did provide in person, and I believe electronically as well. So going back to VA disability compensation, and that Agent Orange Vietnam veteran. And so let's say this Vietnam veteran has diabetes mellitus, or another common one, hypertension. Those are presumptive conditions of Agent Orange exposure, meaning if a veteran served within Vietnam from 1962 to 1975, or within 12 nautical miles of the Vietnam coastline, or those other locations that I referenced, and there are other ones, and they had hypertension or diabetes, the VA will service connect that condition and grant them monetary benefits, and there are healthcare benefits that come along with that as well. One thing that has changed is all Korea War, World War II, and Vietnam veterans qualify for free VA healthcare. They do not need to be receiving veterans pension or VA disability compensation. If you have more questions about that, you're more than welcome to reach out to us. But that's something that a Vietnam, World War II, or Korea War veteran that served in the theater, they qualify now for free VA healthcare. Now, before I move on to those healthcare issues, let's continue on with the benefit part of the VA. So the other benefit is called veterans pension. That one is for low income veterans only. There is an income cap. So if you're a single veteran with no dependents and you don't need the care of another individual for activities of daily living are cooking, cleaning, bathing, dressing, then that rough dollar amount right now is about $17,000 for a single veteran. So if that veteran makes $20,000, they are not eligible for veterans pension. However, there's a catch. Unfortunately, we do have non-reimbursable medical expenses, and we can use those dollars to lower that veteran's income. And so your income is $20,000. Let's say your non-reimbursable medical expenses for the last 12 months was $10,000. Well, now we've just lowered your income from $20,000 to $10,000. And if the VA says they'll pay you the $17,000 number, they subtract your income, which we've now lowered to $10,000, and the VA will pay the difference, which is $7,000 divided over 12 months. That does change every year for veterans pension as your income fluctuates and as your non-reimbursable medical expenses fluctuate. Now, in that same program, veterans pension, if that veteran needs the assistance of another individual, that amount goes up. Not much, but it does go up to about $26,000 right now. What veterans pension is supposed to help that low income veteran kind of navigate their life and those medical issues. Now, those are the primary benefits for veterans. Now, there is a supplemental benefit that a veteran can pursue called aid and attendance. Aid in attendance is when that veteran needs the care of another individual for activities of daily living, like cooking, cleaning, bathing, dressing. There are levels to that aid in attendance. So the first level is called housebound. That means that veteran cannot leave their residence without the assistance of another individual. So many of our spouses, we drive for our veterans. That veteran maybe can no longer drive on their own. That veteran now meets that housebound status and should pursue that special monthly benefit. But in order to have aid in attendance, you have to have a primary benefit first, which is either disability compensation or veteran pension. Aid in attendance is a supplemental benefit that gets attached to either one of those benefits. And I really want to emphasize that because there's a lot of confusion about how and who can pursue aid and attendance. A lot of veterans and their families think that you can just strictly pursue aid and attendance through the Veteran Benefit Administration. That's not true. You have to have a primary benefit first, then you can pursue aid and attendance. However, you can pursue a primary benefit with aid and attendance at the same time. You just have to have that primary benefit granted before you can get aid and attendance. I know I'm giving y'all a lot of information today. I'm throwing a lot of numbers and governmental jargon, but just give us a call. That's what we're here for, is to guide you through that process. We empower the veteran community through education and advocacy. So once again, there's those two primary benefits through the Veteran Benefit Administration, disability compensation, where we're saying that this current medical condition is a result of the veteran service. And then you have veterans pension, where we're saying, while the veteran may not have any disabilities related to the veteran service, they're of lower income and require it medically. Because for veterans pension, you have to be at least 65 to pursue that benefit, or you have to be deemed disabled prior to that age. And that's one of the criteria. Because for that veterans pension, once again, it's designed for a specific demographic of veteran who's experiencing extreme financial hardship. And those are the two primary veteran programs through the Veteran Benefit Administration. Now, let's talk about the Veteran Healthcare Administration, because there are benefits through the VA on the healthcare side that a veteran does not have to receive a primary benefit for. Once again, we talked about, I had mentioned how a Vietnam veteran, a World War II veteran, or a Korea War veteran qualifies for free VA healthcare right now. You can do that online via fax or mail. My recommendation is to take that veteran in person if able to enroll into VA healthcare. If they're in a assisted living facility or nursing facility, there are other ways that you can submit that application, and I would recommend probably doing that one online. A lot of individuals have their own insurance. Maybe they're military retirees who have the TRICARE insurance. I still recommend veterans pursue health insurance health benefits through the VA. There are additional services that you have to be active for in the VA healthcare system to pursue. One of them is called the Comprehensive Family Caregiver Program, where the caregiver of a veteran who fits a certain criteria typically can't feed themselves, dress themselves, bathe themselves, and some other criteria that I provided in person. And if you don't have it virtually, we'll make sure to get that to you as well. Where that caregiver who's already maybe that family, that spouse that's already providing those caregiving services, or maybe that neighbor or that friend, or maybe that son or daughter can actually get provided monetary support through the VA. There are levels of care, for that one. I can say in my experience, for those who pursue that, most people get approved if that veteran cannot feed themselves. If that veteran does feed themselves, it has the ability to feed themselves, I do see likely that they will not be, approved for that benefit. I still recommend pursuing that benefit. The worst thing that the VA could tell you is no. I'm a firm believer of always turning over that rock, because you never realize what kind of benefits could possibly, be there. Also being enrolled into the VA Healthcare Administration, besides the caregiver program, there's something called the Geriatric and Extended Care Program, which they can actually provide home-based care, to that veteran. Let's say that veteran has cognitive issues and they're not confined to the home. The VA can actually send somebody to the home to provide just a healthcare assessment. It's not what we think, it's kind of like home health. If anybody's familiar with that, where they send a nurse out to essentially do evaluation, but they're not actually sending like a caretaker, a caregiver out. But that is something that is available, and that I did provide that today. That's called the VA's Geriatric and Extended Care Department, and that's called home-based care. That's why I really recommend, every veteran at least have a discussion about benefits or spouses. I do want to talk about survivors of veterans as well, because we do have survivors pension. So for both survivors pension, what that means is that surviving spouse is the survivor of a veteran who served at least 90 days of active duty service with at least 1 day during a wartime period. If that's true for that veteran, that surviving spouse can pursue survivor's pension with aid and attendance should they need the assistance of another individual for activities of daily living. So survivor's pension is just like veteran's pension, but for the surviving spouse. So once again, that income cap, the VA calls it a maximum annual pension rate. And right now, I believe that maximum annual pension rate, once again, is roughly about $17,000, and I'm rounding up, to be honest. But if you want that exact dollar number, you're more than welcome to reach out to our office. You can also, Google VA maximum annual pension rate. And that'll typically be the first link that populates. Another survivor's benefit, because there are only 2 benefits a survivor could pursue. We briefly talked about survivor's pension. There's another benefit called dependency and indemnity compensation. That benefit for survivors is available for survivors of a veteran who was either killed in action during service or was 100% for at least 8 years, or had something called total disability due to individual unemployability, which is a benefit similar to 100% permanent total. I won't muddy up the waters and talk about that today, but we can always go into that in further detail. And then the last potential criteria is that veteran passed away from something that was service connected or something that should have been service connected. So for instance, let's say a veteran was service connected for ischemic heart disease, also known as coronary artery disease, coronary heart disease. And the veteran passes away, and that's listed on the veteran's death certificate as either a primary factor or a significant contributor in their passing. That surviving spouse can pursue that dependency and indemnity compensation, and if granted, will receive a monetary amount for the rest of their life. There is no income affected, there is no income cap. That is a monthly benefit that's tax-free for the rest of that survivor spouse's life. Right now, it's about, I think it's about $1,650. It does go up every year and it is tax-free as well. And that's called dependency and indemnity, compensation. Aid and attendance can be used in conjunction with that survivor's benefit. So then that's when we call that special monthly compensation through that disability side or special monthly pension for that pension side of the house. So we talked about disability compensation, veterans pension, aid and attendance. Those are three benefits that are all under the Veteran Benefit Administration. Disability compensation and pension are primary benefits. And aid and attendance is a supplemental benefit that gets attached to either one of those primary benefits. In order to receive aid and attendance, you have to be approved for one of those primary benefits first. Same thing goes for the surviving spouse as well. If they pursue survivor's pension with aid and attendance, they have to be approved for survivor's pension first. Or that dependency and indemnity compensation, they have to receive that benefit before they can receive the aid and attendance. Now let's briefly talk about veteran and the spouse are currently living. The veteran needs aid and attendance and has a VA disability rating of greater than 50%. And what I mean by VA disability percentage is the VA will assign percentages for those items that they deem related to the veteran service. The percentages are a reflection of the severity of that medical condition and those symptoms. For instance, if a veteran service connected for their back, just painful motion of your back is 10%, and they can be increased regarding their limited range of motion and how debilitating it can be. We also talked about the Veteran Healthcare Administration and how there are potential benefits through that avenue as well as that department, because that is a separate department from the Veteran Benefit Administration. So one question that always comes up is, Michael, can I receive disability compensation with aid and attendance and also receive healthcare benefits through the VA? Yes. Can you receive disability, receive healthcare benefits through the VA, and also see your private civilian doctor? Yes. For me, I am a military veteran. I am enrolled into the VA healthcare. I'm a medical retiree, so I have TRICARE, and I also have civilian insurance. I see VA providers and civilian providers. There's a lot of misinformation about that, so I want to make sure that we talk about that. And veterans can see any providers they want, to include their VA provider. Just make sure they're all talking with each other, right? If anything, you can continue to go to your civilian providers, but at least go to your annual VA medical appointment just to stay active. The VA does have social workers as well. So in that geriatric and extended care program, they do have social workers that can help you to kind of navigate those programs. Now, of course, the VA is struggling to kind of navigate with their workloads, like most of the nation, but they are being very efficient with it. In my experience, often when I have an issue, I can find somebody within the VA. Sometimes it just takes me a little bit of time. So don't give up on your struggles of trying to navigate the VA system. It is the biggest healthcare system in the world. And so for disability as well, it's pretty big. Texas, we're now #1 in veteran population.
Wow.
That wasn't supposed to happen until 2038, actually.
Wow.
But that happened actually earlier this year.
Hmm.
Also, the PACT Act, everyone has been talking about it since it was right before it came out. And while it's a fantastic thing, I'm a burn pit veteran, so that actually impacts me as well. While it's a fantastic thing for veterans and their families, a lot of organizations were not prepared. The PACT Act was supposed to be rolled out in increments. But at the last minute, it was signed effective immediately by President Biden, which was a fantastic thing, but it was created a significant backlog. Right now, the VA is telling individuals they can adjudicate claims on average, VA disability claims, on average within 108 days. You can go to their website, that's what it'll say. And while I say that's fair, I would say that's not appropriately representative of the bigger picture. In my experience, I'm gonna say they're taking closer to 8 to 10 months. And there's not a lot of consistency. For instance, I submitted a survivor's dependency and indemnity compensation claim. And in less than 30 days, hers was complete. When I submitted 6 other ones, theirs are still outstanding. So that's kind of what I'm talking about with the delays and the inconsistencies, but we are talking to our VA representatives and our leaders to get this identified. And we have had positive outcomes, but it does take some time. But if you have that issue, or if you know somebody in Williamson County who's having issues navigating the VA system, please have them reach out to us. Our bread and butter is VA disability compensation and the field to include pension. But we're the one-stop shop for pretty much all information, healthcare, education, even Department of Defense benefits like the Survivor's Benefit Plan. And if we don't have that answer to your question, we'll connect you to the appropriate person or point of contact who should have that answer. Because unfortunately, another hurdle the veteran community, amongst other communities, struggle with is getting referred to the appropriate person. How often does it happen where you get referred to somebody and they said, well, why did Michael refer you here? He should refer you to Jesse. And then you call Jesse and Jesse goes, well, why did Marie send you here? Because actually, Michael should have referred you to somewhere else. And so for us is we kind of do our due diligence. If we're referring you to a local agency, that means that's somewhere where I'm gonna refer my family member as well. Because for us, we believe in the human approach. At Williamson County Veteran Services, you are not a number. You're a name, you're a voice, you have a story. And for me, in our office, that absolutely matters. Because for us, the empathetic approach is the most successful approach, especially when we're interacting with our community. I'm not sure how much time I have to talk today.
We have till noon.
Oh, till noon, okay,
Yeah.
okay, perfect. Okay,
There's questions or
Okay, yeah,
however you
absolutely.
feel, yeah.
Can I throw something in if you don't mind?
Absolutely.
So for about a year now, I've been a facilitator through the Alzheimer's Association, joined with the veterans. It says here VA support group. So every third, they run them every second, but every third, I facilitate a support group on Zoom. And I would just suggest anybody that is a veteran or veteran spouse, the spouse, please get on the support group Zoom, because what we talk about exactly are spouses that are in different stages, and they help each other, as most support groups do. They talk amongst themselves. But it's just really rewarding to hear a spouse who's been through this journey for a couple of years. And almost everybody is at home taking care of their veteran at home. So Gail, is just a really nice way, Jerry, Karen, to connect with other people that may be going through what you're going through and can answer questions.
When is your support group?
I'll give you the information afterwards. The one I facilitate is the third Tuesday of every month from 11 to 12. Do you know Revonder?
Revonder. I don't believe so.
She must be one of the case managers
Okay.
that helps me run it, but it's just wonderful because it's you know, twice a week you can get and talk to other people that are going through exactly what you're going through, and ask them questions. How'd you navigate this? What can you help me with? I'm brand new in this journey. So the VA support groups are wonderful.
Yeah, that relatability is absolutely matters. There is a VA support group phone number actually, or support line phone number. It should be on that form. If not, I'll make sure to get that information to y'all. But it actually is good information. My father was a Vietnam veteran. And towards the last 6 years of his life, me, my wife, and my mother were his caregivers. So I'm definitely familiar with the struggles of the caregiver and not having access to information. I mean, that's actually how I became a veteran service officer. I was just Googling one night in 2014, frustrated as a caregiver, trying to find more resources because my father's health was declining. And I found out that there's something called Agent Orange that he was exposed to in Vietnam. And then I found out that there was good potential benefits. And so I actually contacted the Hayes County Veteran Service Office, and he's the director there, and is actually a really good friend of mine now and colleague. His name is Jude Prather, and he was actually the one who did that intake for my father, and he let me join. So that was the very first case I got to help with, actually. And my father actually ended up getting 100% VA disability and a check for $58,000. And he was shocked, but he felt guilty because he was misled in believing that by him pursuing benefits, he was taking away from somebody more deserving. That's not true. Everybody who served is deserving. By a veteran pursuing their benefits, they're not taken away from anybody else. So if you do find one of those veterans, tell them that. They are already budgeted as part of the VA and Department of Defense's budget, so they might as well access the benefits that they're rightfully entitled to. You know, they served our country proudly, and as veterans, all we ask our country is, if you break it, you bought it. Nothing more, nothing less. Any other questions before I move on to some other benefits?
Explain if you break it, you bought it, because I only know that in a store.
That's true. So for VA disability compensation, so for me, I was medically retired for my back. I'm 37 now, but I was 26 then, and I still thought I could do it all. But unfortunately for me, I had the spine of a 65-year-old man then. So when I say they broke it, they bought it, is our country made a sacred promise to continue to care for the veteran and their widow that proudly served their country. So I have these injuries that were a result of my service. And so the government stated that they're going to continue to take care of me for the rest of my life, essentially. That's what I mean by you bought it. Because there's a lot of veterans who go through many issues, maybe they have injuries in service, and they think that's just a way of life. Ringing of the years. A lot of veterans relate and experience ringing of the years, but they think, oh, that's related to everything else but my service. Well, actually, if they had noise exposure, more than likely, it was related to their service, actually. And so that's, you break it, you bought it. Hey, I have this medical condition that was a result of my service, and you, government, said you would continue to take care of me because of that injury as a result of my service. But unfortunately, a lot of veterans were made to feel like we have to beg for our benefits. These are our entitlements. The VA and the Department of Defense is not going to issue a veteran benefits that they're not entitled to. And I say these things because I'm new to Williamson County. I'm coming from Hayes County. I've been doing this since 2016, and I have never been in an area this area right here that has so many veterans that have never accessed their benefits before. I have helped so many my offices have helped so many Vietnam veterans just the past 6 months as a result of our outreach. But then they didn't even know they were eligible for benefits. So that's why we continue to engage with the community. If you know somebody who's connected to the military community that hasn't had a conversation about VA benefits or potential VA benefits, have them have that conversation. If they don't live in Williamson County, there's 189 offices like mine in Texas. And so if they don't know how to access that office, they can always reach out to us. They can tell us which county they reside in, and we will provide them with that contact information. Because while we are here to service veterans and their families, we are provided by the Williamson County taxpayers. So we make sure to provide them services, but we don't turn anybody away whatsoever. So any general questions, if you don't live in Williamson County, we'd be happy to answer those. Typically what we'll do is we'll refer that veteran or spouse to their county representative, their VSO, if you will. And we'll tell them, if they don't call you back within usually a week, give us a call back and we'll continue to assist you. Because once again, it's all about just making sure we service the veteran, community. And remember, all 189 offices are provided by taxpayer dollars. So there's no monetary fees whatsoever. There are a lot of private agencies that do what we do, but charge anywhere from hundreds of dollars to thousands of dollars. There are agencies that are out there that will guarantee a veteran in a nursing home aid in attendance. And that's unfortunately, I'm here to tell you that it's more complicated than that. So before you pursue those private agencies, at least to have a conversation with a veteran service officer. It's a free consultation and they have your best interest in hand. Because we receive no monetary gain for providing assistance to our community. Williamson County Veteran Services, we have the biggest payout for VA disability compensation in Texas history right now. $810,000 we were able to provide to a surviving spouse. So that's why we always tell everybody, have a conversation. For instance, if a veteran who served in Guam pursued benefits related to Agent Orange prior to the PACT Act, they were not eligible for Agent Orange exposure per the law. The law actually said they were not exposed, even though that I knew and they knew as well that they were exposed. Well, the law has now changed with the PACT Act. So let's say that Guam veteran, let's say maybe they passed from high blood pressure. That surviving spouse can now pursue that dependency and indemnity compensation. Because while the law said that veteran maybe didn't pass away from a service-connected condition prior to the law has changed. And now that veteran is identified as having Agent Orange exposure due to their Guam service. And now, because hypertension is listed on their death certificate, that is service connected. So there's a lot of complexities with the law. Even if you were previously denied for benefits as the veteran, the spouse, or the surviving spouse, I always recommend continuing to pursue that. Sometime wording matters. That's why for us, we educate the veteran and the spouse throughout the process, so we know what to expect. So we know what the VA is looking for. Because like many of us, we're gonna be polite and we're gonna be professional, and we're gonna tell that VA examiner who's greeting that veteran, they're gonna say, how are you doing today? And that veteran, or you may say, oh, he's good, or she's good, or I'm good. Well, that VA examiner now has the ability to say, they are reporting that veteran is in good condition. That's not what you meant. You were being respectful and polite. So that's why we really educate kind of about the do's and the don'ts about that process. But we do that in increments to not overload the veteran or the spouse, because the VA system, it can be very overwhelming at some point. That's why my office exists. So we talked about VA disability compensation, pension, survivor's pension, DIC, aid in attendance, healthcare benefits. One thing I also want to talk about, that unfortunately a lot of people don't want to talk about are benefits through the National Cemetery Administration. So a lot of people always have a question about, am I eligible for burial at a federal or state veteran cemetery? Typically, if that veteran has an honorable discharge, yes. And that's something that our office assists with as well. So hopefully that doesn't impact anybody here for many years. But should that be you or anybody you know, please have them reach out to our office, because what we do is we guide that surviving spouse through that chapter. Somebody did that for my mother, Jude, that VSO in Hays County, and me as well. I got to help her with that. And I'd like to pay it forward, and that's what our office does as well. Is essentially, we walk that journey with that surviving spouse. We will even contact the VA. For instance, I'm still gonna, respect their privacy, but I had 2 surviving spouses that I assisted personally this past month. One was bedbound, one is just all on her own and struggling with her own health issues. Both veterans passed, and they wanted to get their husbands rested at the Killeen Veteran Cemetery, but they had no way to facilitate that. So what our office did was we coordinated with the funeral home. We coordinated with the Killeen Veteran Cemetery and with the Department of the Air Force and the Department of the Army to make sure they got the military honors. And I personally picked up their remains and took them up to Killeen and had them rested, actually. So for us, we will continue to go above and beyond in serving the veteran community in a superior way. Now, I do ask for patience. There are only, I have a team of 8, including me, to service 38,000 veterans. That doesn't include their spouses and their eligible children and their surviving spouses. So that's really, if you think about it, the veteran community, we have at least 100,000 people here in Williamson County. And they all are important. So I promise you, it may take a little bit to get in with us. But once you get in, you're gonna see that experience is gonna be overwhelmingly positive. Because for us, we're gonna treat you like a person. We're gonna listen to your story. And guess what? If your appointment goes over a little bit, that's okay, because you matter. The next person, they're gonna still get their time with us, but your time is valuable as well. And we try to be efficient as much as possible. We all have so many things going in and out of our day, so many duties and responsibilities. And so for us, just know that we have your back. I am not the VA. I am the County Veteran Service Office that's provided by Williamson County. We receive our accreditation through the Texas Veterans Commission, which is our state agency to assist veterans and their families. So if you want to talk a little bit bad about the VA, I'll join you maybe. The VA is not all negative, however. It is a positive organization. It's just, you have to know how to navigate and kind of go over those little hurdles, if you will. Just like many other organizations and social services as well. Veterans, we are not excluded from those same hurdles that a lot of other demographics come across when they're trying to achieve their own benefits as well. And so if you take anything away from this conversation today, I want to at least have a conversation with a veteran service officer about potential benefits. And I know sometimes it's hard to have certain discussions, especially about, caregiving services, nursing facilities, and burial services. But for me as a veteran, and me doing this as a veteran service officer, I think we need to have these conversations more often than not, kind of like mental health, right? Mental health is, everyone feels alone until we talk more and more about it. Caregiving. When my father passed away, that was a huge impact on me. I was a student, I was a young VSO intern and a caregiver. He was part of my identity, and then I lost that identity when he passed away in 2017. Then I had to figure out, well, who am I again? Because yeah, I'm still those things, but that part of me, I had to redefine, if you will. And so I did go to like grief. We talked about caregiving services or caregiver support, but also grief support, right? That's important as well. That a lot of compassion fatigue is a real thing, and I think that's normal. And if we talk more about that, you'll realize you're not alone. And it does not mean you're a bad person if you feel like that. Because being a caregiver is quite difficult. Not everybody can do it. And so let us know how we can be there for you and your family. Because that's exactly what we're there here for, okay? Any questions? Yes, ma'am.
Our son took my husband and me to see the Temple VA home. And we were really impressed with it. But the problem was visiting back and forth to Temple. And yesterday, this didn't have to do with the VA, but two fellows told me that I should really pursue what's on Estrella, what's it called? Wesleyan, that they had a woman from their church who lived there for years and somehow I don't know if the VA helps with that kind of place.
That is something, so for instance, would you know, was she a survivor or the veteran? Probably.
He was saying she was a United Methodist, and I don't know if that has something to do.
There was a benevolent fund at the Wesleyan connected with, First United Methodist Church. So I'm wondering if maybe the benevolent fund
Oh.
kicked in and helped pay, or I'm not sure.
Could be a combination, because like, so for a veteran, let's say, for instance, we'll use both scenarios. She's a veteran receiving aid in attendance. While they're in an assisted facility, if it's veteran's pension, whatever amount they're receiving gets reduced, and that facility gets the rest of that amount. So some facilities will waive whatever fees and just accept that monthly, so that could have happened, and maybe in conjunction with the benevolent fund, so.
Right.
That is something that if this, the VA does do. So for instance, the Texas Veteran Land Board, they have their own assisted living facilities and nursing facilities. And if you go in there and you're receiving that benefit, it gets reduced. They get most of it, and the veteran or spouse gets about, I think it's $90 actually. But that is something, yes, that is potential. I will say, I know the state's working on creating more facilities, but you're right, the closest one to us is in Temple, actually, so. But you can utilize it at private facilities as well. The issue that I see with that is the VA only covers up to an X amount of dollar. So as we all know, memory care is very expensive. It can be very expensive, actually. And so in my experience, yes, pennies do matter. But in that aspect, it doesn't add up too much. I still see the family member, the veteran still incurring a significant cost, even with the aid and attendance, from the VA.
Well, the last I heard, just the VA place alone is $47 a day.
Yes, it's probably gonna go up.
I was thinking, that was the last I heard, but that's been a while.
Because if we think about it, the VA, they, all World War II, so another thing I wanted, and I actually thank you for bringing that up. So there's a fallacy that's being perpetuated that World War II veterans qualify for free assisted living care. That's not the whole picture. They do qualify for free, 100% free care if they have a VA disability rating of at least 70%. That's the catch, is if a World War II veteran has a VA disability rating of at least 70%, they can receive 100% free nursing care wherever they're at. My concern is, I don't know too many World War II veterans that have a VA disability rating of at least 70%. My opinion, we should have just given it to them, honestly. There's not too many of them, to be quite frank. So I think that's something we could have facilitated, but I don't make the rules. I just play the game.
Play the game.
Did that answer your question?
I
About
think so,
the,
and I think you were right, that this was the benevolent fund probably from United Methodist.
I used to work at the Wesleyan for a long time,
Oh,
and it's, it's a benevolent fund, and first it was created more for retirees from the First United Methodist Church, like their pastors and their, yes. I haven't heard it ever in conjunction with VA, sorry about that.
Yeah, it didn't happen.
Yeah, I think the benevolent fund took over.
I do wanna, another thought came to mind, so memory care. So I'm starting to see, and these are my correlations, my opinion. I'm starting to see a lot of Vietnam veterans getting diagnosed with dementia. And a lot of these veterans, Vietnam veterans, they have high blood pressure. So it's vascular dementia. And so while maybe the vascular dementia isn't directly related to their service, it's secondary to the high blood pressure that can be pursued for VA disability compensation. And we can get that granted and essentially get benefits for that, actually. For instance, let's say that Vietnam veteran, and I use Vietnam veterans just because, I mean, that's really my specialty is World War II, Korea, and Vietnam veterans. Veterans of my generation were kind of easy, to be honest. It's the older generation that, you know, that were taught, drink water, drive on, don't go to medical, mission first, self second. Essentially, those are kind of our specialty, but to go forward, we do help with them as well. And so another, I would say, condition that seems to be correlating a lot to that hypertension is, of course, having a stroke, right? Or heart attack. Heart attacks are already presumptive of Agent Orange exposure. That's called ischemic heart disease. But that stroke, if we can argue that it was a result of the high blood pressure. A lot of people think that in order to pursue VA disability, is you have to prove 100% without a doubt that that condition that you experience today is a result of your service. Not 100%. It's actually 51%. The verbiage is at least as likely as not, probability greater than 50% it's related to service. The VA has to argue the same. Probability of less than 50% that it's related to service. The law says if the VA cannot prove or disprove something related to service, that's a legal term called equipoise, meaning it's balanced, and they still have to give it to the veteran. The issue that we're experiencing is the VA has a lot of new employees, and they are not completely versed with the law. So we brought this up to our VA leaders, and we were actually in Colorado 3 weeks ago at a national conference, talking to them about this. And they said, tell your veteran community to be patient and continue to appeal unfavorable decisions. So if you're pursuing your own VA benefits and you receive an unfavorable decision, please don't take it as final. There are no decisions that are final. All you have to do is review the decision. The VA will tell you the answers to the test. They'll tell you what you're missing. Or they'll show us where the VA messed up. I can tell you that we audit every single VA decision that essentially we get from our clients. 9 out of 10 do have errors in them, whether they're significant or not. But I can tell you 9 out of 10 do have errors, even if they're just grammatical. And for me, that's a concern, because that tells me if those are the small errors that we're catching, where are the bigger errors? So for instance, prior to this meeting, I was informing those present that the VA's automated review document system, or their artificial intelligence, was supposed to be disseminating claim applications for development and processing. Well, the VA publicly acknowledged that that system had been failing to do that for many years. And now, not every claim was affected, but there were thousands. And they're currently working on that. And so that is another issue with the delay, is we are having certain items or certain claims sitting in phases of the claim process for months with no development. And we now know what the cause is. The cause is that it was not being appropriately disseminated to those regional offices for additional development. Even when we were submitting and continue to submit a priority processing request, they are not being intaked appropriately. We've been working with our congressional leaders, our House leaders, our VA leaders And they are aware of this, but the issue is still happening today. So for our office, that's why we walk this journey with you. Now, we empower through education and advocacy. This is your bike to ride. You may stumble, you may fall, but you can always look back and we'll be there to pick you up and continue to guide you on the way, okay? Think of us as your training wheels. So, you know, with the VA, there's a lot of pros, there's a lot of cons, but there could be, you're not hurting yourself whatsoever in pursuing your benefits. I would like to mention that if you do pursue veterans pension or survivor's pension, Social Security income does go against that. So there's always a concern of why is my pension going down every year? Well, maybe your income's going up every year. Social Security does get a raise, not much, but does get a raise every year. And the law says that for pension, if Social Security goes up, pension must go down. That's where we use the non-reimbursable medical expenses to maximize that benefit as much as possible through the pension avenue. A reminder that disability compensation or dependency indemnity compensation, there's no income affects those two benefits. It's only for veteran or survivor's pension, whereas there's an income cap, okay? Any other questions? Yes, ma'am.
Am I in the correct understanding that if you have a current, retired, officer that, currently receives his military retirement and then also the VA retirement, he then passes, the surviving spouse has the ability to still collect both?
So potentially, yes. So
Or is
that's
that
a,
VA?
no, that's actually a great question. So for retirees, and is this retiree have at least 20 years?
Yes.
Okay, so perfect example. So this retiree for 20 years, there is special clauses for them. So if a retiree has at least 20 years of active duty service or eligible service and has a VA disability rating of at least 50%, they are automatically enrolled into a benefit called concurrent retired disability program, yes. And what that means is you receive your full retirement and your full VA disability. There is no offset. If that retiree had a rating of 40% or below, that's where they would get paid offset.
Yes.
Meaning that if their retirement was 5,000, the VA said they'll pay them 1,000, all it does gets lowered to 4,000. Yep, absolutely. So it saves you some money on taxes. Now, what you mentioned about survivors' benefits, yes and no. So for retirees to transfer their retirement over to a surviving spouse, they had to have enrolled that survivor into the survivor's benefit plan. If they did not do that, unfortunately, that survivor is not eligible for the 55% of that retirement. Cannot do that after service. You have to do that while you're in service, actually. There was an open period that closed December of this year. So unfortunately, that time period is now closed. But if you're still in the service, you can do that. And that's a DoD benefit, a Department of Defense benefit. And we do have their contact information as well. Now, for the VA side of the house, for that surviving spouse to get that benefit, the veteran either has to be 100% for at least 8 years, pass away during service, or one of the service-connected items was a result of their passing. So let's say the veteran passed from Parkinson's disease. And let's say that veteran was a Vietnam veteran. Well, Parkinson's disease is a presumptive condition of Agent Orange. And so even though the veteran wasn't 100% for at least 10 years, Parkinson's disease was still a contributing factor in that veteran's passing, and that almost automatically grants that surviving spouse benefits. Yes, ma'am. And there's so let's just say in this example, that Vietnam veteran was not receiving any VA benefits, and now the surviving spouse comes and says, hey, am I eligible for anything? Well, I see that the veteran served in Vietnam, I see that he was medically diagnosed with hypertension, and even though it's not on his death certificate, we would submit that claim and then make an argument that while hypertension was not listed on the death certificate, it was still a systemic disease, and it was still a significant contributor in the veteran's passing. And typically, we're very successful in doing that. as well. So even if that veteran is not service connected for any items at the time of their passing, have a conversation with us at least, because quite often, when we do investigate if there's any potential benefits, we'll find them. Absolutely. Does that answer your question? Mark?
Yes, yes. I know there's been some major discussion with our retirees about leaving their spouses desolate because of everything being stripped from them. And yes, they did choose SVP, but then they thought, they assumed they would still get their VA portion of it.
Hmm.
And it sounds like that's up for grabs.
Correct, so when the veteran passes, everything stops. All DOD and VA benefits stop. And then the surviving spouse has to pursue their own benefits. That's that survivor's benefit plan for the military retirement, or survivor's pension, or the DIC for short, through the VA. Yes, absolutely. And that's a conundrum, unfortunately, is, you know, the veteran passes on May 17th. The VA is gonna garnish some of those funds. And are they appropriately telling that spouse? Sometimes they will. I would say sometimes they will, sometimes they don't though. And so now that surviving spouse is getting that month's garnish, they weren't expecting that. And so I do want to mention as well that our office, I'm happy to say that we were renewed for our financial assistance grant. So we're gonna go into our second year for our financial assistance grant for veterans and spouses and Williamson County. So if you're behind on any rent, mortgage, utilities, you need some food, we even do funeral assistance, all those categories up to 1,000 right now, unfortunately, but you know, every penny counts. And we can possibly assist. The only veterans or spouses we cannot currently assist are those that receive other than honorable discharge. Unfortunately, right now, we cannot assist those, but maybe in the near future, we'll be able to do something. And I would like to mention, even if a veteran has a dishonorable discharge, have them contact our office. The VA is actually providing healthcare benefits to the veterans that receive the dishonorable discharge. But also, we investigate, was the dishonorable discharge related to something in service? For instance, I know somebody who's a Vietnam veteran who does not live in Texas, so I can say the story. And he had 8 DUIs before the VA would see him for mental health, dishonorable discharge. Well, he finally went to the VA, got mental health treatment. Turns out he was diagnosed with mental health conditions related to his service. And we were able to use that evidence to pursue a discharge upgrade. That's why he was doing that, is because he was suffering from undiagnosed mental health. And actually, he's in a great place now, and we were able to get his discharge upgraded from dishonorable all the way to honorable. Because we were able to prove that he was suffering from undiagnosed mental health condition to led to all those occurrences. And actually, he had a psychiatrist that said that as well. So just have a conversation. You really just never know who's eligible for benefits. I'd rather you turn over that rock and find nothing than maybe there was something underneath that rock that whole time. I know for my father, you know, I briefly mentioned his story, and he was shocked. He was financially well off, not health-wise, he was not well off, but financially, he was well off, and he just thought, wow. I remember he like, I should have just done this a long time ago. But remember, the VA has evolved. The Agent Orange Act came out in 1991. Then you have the Blue Water Navy Act for the sailors in 2017. And now you have the PACT Act for those other theaters for Agent Orange. So laws are continuously changing. VA is modernizing. So have a conversation with somebody, you know, especially think about the people who serve at Camp Lejeune and their families. They didn't think there was anything wrong with the water they were drinking. Unfortunately, it was extremely contaminated. And some of them unfortunately are no longer here because of that contaminated water. So let's have those conversations. If anything, if you're the veteran, we owe it to our family. And, you know, for the family members, you know, I owe it to y'all to support y'all. So please let us know what we can do for y'all. And if no other further questions, yes, ma'am.
This may be a question for Colleen for the VA cemetery, but do you know, or does anyone know if they accept green burials, if they have an area?
I think they do, I'm trying to remember because they do have a garden. Are you talking about like actually performing the green burial there?
Yeah,
I don't think they do that.
accepting that kind of casket that's by.
Oh, yeah, absolutely. Yeah, no, that's definitely, because they, like you're talking like the wooden caskets or something decomposable.
Right,
Yes, that is something they do.
oh, good, okay,
And they have different sections, if you will, like they have
Yeah.
a mausoleum section or crematorium, like an upright section. They also have an in-ground section. And they have other like sections regarding upright headstones and then just the flat markers. Because some people don't want the upright headstones, some people just want a nice little flat markers. There are options, yes.
Thank
Any other questions today?
any questions on Zoom? I think your mic is off. Let me stop recording.